Hi, Dr. Harrison here, and today I want to talk about acupuncture, which is the fastest growing portion of complementary alternative medicine, or CAM they call it, in the United States and probably even around the globe. A few years back, I would say going back maybe 5 years now, I had patients coming in all the time asking me, what do you think about acupuncture? Do you know a good acupuncturist? Do you think it's okay for me to go to an acupuncturist? And I would say, well, I don't know any personally, but definitely I think there's merit to it, or otherwise it wouldn't still be around. This is something that's been around for nearly 5,000 years, and obviously insurance carriers are starting to approve it now, and so there must be some efficacy to it. But I don't know any acupuncturists personally. But if you want to try it, go ahead, and if it helps you, I'm all for it. So, this went on for a while, and finally I got tired of answering all these questions and fielding all these questions on acupuncture. I decided, well, why don't I just learn acupuncture myself so that I can have it available for my patients? So I talked to some friends who I knew were certified in acupuncture and found a college up in Chicago area. And so for 1 week in a month for a year, I flew up to Chicago to learn how to do acupuncture, because they had told me this is where the gentleman who was really good at teaching you how to insert the needles, doing a lot of hands-on, where he was located, and this is where I should go to learn. And I'm glad I did, because since then I've learned of other colleges where they don't do quite as much of the hands-on training. And I wanted to make sure, number one, that I was very comfortable in inserting needles into a patient and making sure that I was doing it correctly. And I'm sure the patients would appreciate having a doctor who is actually experienced and had a lot of hands-on experience inserting needles if they're going to have somebody do that to themselves. So that's how I went about doing that. So I've been certified now in acupuncture for several years, and we've had just a great response in the office with it. Anything from anxiety, depression, neck pain, back pain, sinus issues, appetite suppression, all respond very, very well to acupuncture. So your next question may be, well, how does acupuncture work? Well, the theory behind acupuncture is that there are energy lines in the body, or areas that travel through the body, and they split those up into 12 meridians, 6 on each side. And so these energy pathways that travel through the body are related to organ systems. So you have, for example, a liver pathway, and you have a gallbladder pathway, and you have a kidney meridian, for example, or a heart meridian. Well, these meridians, or energy pathways, they've mapped out over the years, and along those meridians they have documented points, and they call those acupuncture points. And stimulating certain points can help balance energy in those pathways. So the theory behind acupuncture is that those meridian or energy pathways carry that energy, which they call qi, and that can be thrown out of balance, whether maybe you've got toxicity in the kidney, or maybe you were exposed to a pathogen and you're developing a cold, for example, and your energy meridians become out of balance. Well, you could apply certain needles to certain acupuncture points to either upregulate or downregulate these energy pathways to bring them back into balance. So that's how we go about applying the needles, and knowing where to put those is based on, number one, symptomatology. And then there's also new technology that's come out where we have computer programming that will measure the energy running through those meridian pathways on a biofeedback type mechanism, or what they call resistance. And that program, which is in the computer, will actually recommend points for us to hit to bring that energy back into balance. So now we've got even computerized methodology of determining which acupuncture points to hit, which is really pretty cool. If you have any interest and you've been wanting to find out more about acupuncture, please feel free to call the office. The consultations are always free, and we can sit down and discuss whether or not acupuncture is a good choice for you. Sometimes I'll find patients will come in and we find that, well, they just have a simple neck pain that might respond much, much quicker to a chiropractic adjustment. They don't really need the acupuncture needles for that particular problem. However, I find that acupuncture seems to work really well when nothing else seems to be working. And maybe it's not so much a structural problem as it is an energy problem going on with the body. So I hope this helps. I hope you found this informative. If you have any questions on acupuncture, please feel free to call the office, and I look forward to seeing you soon.